over the course of an 8-hour workday. Safety regulations in most jurisdictions recommend no more than 35 parts per million. And in the hotel, fire crews recorded a concentration of more than 10 times that. That level can be deadly after just 4 hours of exposure. So with carbon monoxide, moments can be a matter of life and death, both in detecting the gas and responding to the consequences. Tasleem Nimjee is an emergency physician. Good to see you tonight, doctor.
Thank you. You as well.
Okay, so how do you treat carbon monoxide poisoning? I guess it depends on how bad it is, but...
Well, actually, the treatment is oxygen. And so with mild carbon monoxide poisoning or more severe carbon monoxide poisoning, either way, what you're trying to do is give the patient oxygen, and quickly, because you're trying to displace the carbon monoxide out of the system.
And so that would be through a mask, or there's also a hyperbaric chamber. Would that be an extreme measure?
Yes. So typically we treat with high flow oxygen nasally or through a face mask.
Okay.
And that's because you're trying to displace that carbon monoxide out of the red blood cells so that your body can carry oxygen instead. And so if it's more severe, then we do sometimes use a hyperbaric chamber.
Would that be rare?
Yes.
Okay. When they talk about these 15 people who have a more serious case, what would be your guess about how they were being treated or how much more serious it might be?
So I can't say for certain. So we measure carboxyhemoglobin levels in the blood, which gives us an indication of how much carbon monoxide poisoning has occurred.
Right.
But really the big thing is symptoms. It's how the patient presents. So patients can present with mild carbon monoxide poisoning with nausea, vomiting, muscle aches and pains. They can feel dizzy. Headache is a big one.
Sure.
But as the symptoms become more severe, then patients can present with anything that's like a hypoxic injury, so low oxygen injury. People can be seriously confused, significantly confused. People can have seizures, altered mental status. And so those people, again, would be treated with oxygen, but sometimes actually have to be intubated or ventilated on a machine.
And about long-term effects, would there be long-term effects?
You know, that's a great question. So with mild exposure, really no. But with long-term exposures, then we can see the same things we would see when there's a lack of oxygen. So people can actually have heart attacks because of the lack of oxygen. But from a long-term perspective, you can have cognitive impairment as one example that can develop.
Okay, doctor, good information tonight. Thank you.
My
Appreciate it.
pleasure.